Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of the Nashville Coronavirus Task Force and Chair of the Metropolitan Board of Health. Also here to present is Dr. Vladimir Berteau from Meharry Medical College's College of Infectious Disease, and Jackie Schrago. She's a volunteer with Get Covered, Tennessee. Here this morning to help answer your questions will be Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department. We'll now begin with Mayor John Cooper.
Good morning, everyone. I'd like to begin today by marking two important milestones in our fight against the coronavirus. Today's briefing marks Nashville's 100th COVID-19 press conference. It has been a long year. And since the first briefing on March 8th of 2020, our goal has remained the same: to provide everyone in Nashville with the timely, accurate information they need to stay healthy. I'm grateful to everyone who's made these updates possible, especially Dr. Alex Jahangir, Chair of the Metro Board of Health, Dr. James Hildreth, President and CEO of Meharry Medical College, Dr. Gil Wright, Brian Todd, and everyone at Metro Public Health, Chief William Swan in the Office of Emergency Management, Metro Nashville Network, and our wonderful ASL interpreters from Bridges of the Deaf and Hard of Hearing, Amy Lankheit, Forrest Spawnseller, and Eric Borkman. I'd also like to acknowledge Fabian Bedney, who's hosted 100 Spanish language briefings to help our Hispanic neighbors stay informed. The second milestone we are commemorating today is our 1 millionth COVID test performed in Nashville. This is a remarkable feat made possible only with the help of our local healthcare partners. I'm especially grateful to the staff at Meharry Medical College, who are on the front lines of Metro's testing centers. Our testing centers have done their work with enormous courtesy and care. And now an update on our latest COVID metrics. Today, our 7-day positivity rate is 7.3%, up from 5.8% last week. Our epidemiologists have told us that this bump in our positivity rate is likely an anomaly caused by last week's weather event. But with that in mind, Nashville's total case count continues a steady downward trend. Public Health reports 1,614 total active cases this morning, down from over 2,200 7 days ago. Our 7-day average of new cases per 100,000 residents is now 15.1. The transmission rate in Davidson County is 0.75, down from 0.89 last week. This is the lowest transmission rate that Nashville has ever reported. The second lowest was 0.82 in late August. Nashville's COVID case fatality rate also remains exceptionally low. Vanderbilt's modeling on the life-saving effects of mask requirements is proving to be true. At 0.7%, Davidson County has the second lowest case fatality rate out of all 95 counties in Tennessee. Our fatality rate here is 46% better than the average of counties with less consistent mask mandates, and 61% better than counties that rarely, if ever, enacted such measures. Now, at 1.5%, the state of Tennessee is tied for the 32nd highest COVID case fatality rate among all 50 states. But at 0.7%, Davidson County alone would rank among the top 3 states for lowest case fatality rates. Now, these good results are due to your hard work. And now, based on improving conditions, Public Health feels we can safely take another step in adjusting our reopening protocols. So starting Monday, March 1st, changes will take effect that will help our local businesses, while social distancing and mask-wearing requirements stay in place. But among these changes, maximum event size attendance increases from 500 to 1,000 people, pending application approval by Metro Public Health. Events with certain risk factors, like weddings, will be moved up to 125 people from the current 75-person capacity. A maximum of 125 people per floor at restaurants and bars, and an increase in the seating limit at bar counters. Restaurants serving alcohol and bars must close by 1 a.m. This also applies to venues. Outdoor gathering size limit increases from 8 to 25 people. Museums and attractions like the zoo can increase capacity to a level that just maintains social distancing. There are more changes affecting events, transportation, and other activities. Now, some capacity restrictions have been increased or removed, while the proven protection of social distancing and mask requirements stay in place. All of these changes can be found online at covid19.nashville.gov. Now, yesterday, Nashville was named a safe travels destination by the World Travel and Tourism Council. We are only one of only 2 destinations in the U.S. to achieve this designation. The other is Lake Tahoe. And this award is made to cities around the world that have implemented effective, safe practices to prevent the spread of COVID-19. Other safe travel cities include Paris, Vienna, and Madrid. And while we must maintain healthy habits, being named a safe travel city will help our long-term economic recovery as a global tourist destination. I'm grateful to the Nashville Visitors and Convention Corps and to all our hospitality businesses that work so hard to keep their staff and patrons safe. This award has been earned by all the hard work of everyone in the city. Now let's review our vaccine rollout strategy. Metro's assessment centers and vaccination sites were closed last week because of the extreme weather. Every vaccine dose that would have expired last week has been used. Nashville did not waste or lose a single dose because of the ice and the snow. The vaccination site at the Music City Center reopened on Saturday, and all 3 testing sites reopened on Monday. And as a reminder, here's what to do if your vaccine appointment was delayed last week. If you were scheduled to receive your first dose, you will be directly contacted to reschedule that appointment. If you were scheduled to receive your second dose, you can visit the Music City Center at any time, 7 days a week, from 8 a.m. to 4 p.m. 150,698 total doses have been administered in Nashville. That's up from 135,000 last week. Your Metro Health Department is working diligently to deliver excellent customer service throughout the immunization process. Their efforts are helping Nashvillians avoid the long lines and wait times seen in many other cities. And this past weekend, Public Health and our hospital partners vaccinated 1,500 Metro teachers and 1,600 private and parochial school teachers, and 1,000 additional Phase 1B recipients every weekday. Tuesday was the first time that Metro middle and high school students have returned to the classroom since remote learning began. Today is the Metro Schools COVID tracker. That number is at 3.8 out of 10. Well below the threshold of 7 that was required to start in-person learning. Every Metro student who elected in-person learning will be back in the classroom by this time next week. Residents 70 and older have started their immunizations. To date, almost 30,000 Nashvillians in this age group have received their first dose, and there are 58,000 total residents in this group. If you're 70 or older or need to schedule your appointment, please call 615-862-7777. Now, two weeks ago, I announced a citywide campaign to vaccinate more Nashvillians in our communities of color. Our goal is to avoid disparate rates of immunization in our general population, especially among Black and Latina residents. And next Thursday, there will be a virtual town hall hosted by Deputy Mayor Brenda Haywood, State Representative Harold Love Jr., and Dr. Joanna Shaw-Kiki of Metro Public Health. Visit covid19.nashville.gov to learn how to join the town hall online or by phone. 3 additional public health experts will be joining the town hall discussion, including Dr. Vladimir Burto of Meharry Medical College. He's with us this morning to discuss how important it is for all Nashvillians to get vaccinated. Also here today is Jackie Schrago, a volunteer at Metro Public Health, who will discuss how Nashvillians can get coverage through the ACA open enrollment between now and May 15th. It's very important. And I'm pleased to introduce this week's community heroes, our Metro Public School teachers. Since the start of the pandemic, our teachers have been working so hard to engage their students and keep them learning remotely. School did not stop when it went online. And now our students are returning to their classrooms, and Metro educators are doing what they must do to ensure that our schools stay safe. This includes observing important health protocols and getting vaccinated. I'm grateful to the commitment that our Metro school teachers have shown and continue to demonstrate for their students. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Good morning, Nashville. Here's the latest on coronavirus in Davidson County. Active cases dropped 644 from this time last week. We now have 1,614 active cases. This is the lowest it has been in 4 months. Total cases are 89,297, and our rolling 14-day average is 156. This dropped 69 cases since last week. Our 7-day average of new cases per 100,000 residents is 15.1. This metric is now yellow, and it is the lowest it has been since early October. Transmission rate is 0.75. This means, on average, each person with COVID-19 actively in our county is infecting 0.75 other individuals. Because each person is infecting less than one other person, the number of active cases should continue to decline. Hospitalizations in Middle Tennessee now are 331 individuals, down from 369 from our last update. And right here in Nashville, there are 218 individuals hospitalized, down from 224 just last week. Now, as the mayor mentioned, yesterday we passed the 1 millionth mark for testing in Davidson County. This is a really huge milestone, especially when you consider last March, literally we were looking for tests and swabs. So this is amazing. More than 400,000 individuals have been tested in our community assessment centers. And many thanks to our health systems who helped us get those set up. Meharry Medical College, who continues the operations, the Office of Emergency Management, and everything they have done to continue the operations, Metro Public Health, and Hands On Nashville, who have given so much this year to keep our COVID response going. This really is a testament to our city and shows what can be done when we all come together. It's really humbling if you think about it, and it gives me a tremendous confidence as we move forward to vaccinating our residents. I know we'll continue to come together and we'll continue to work together to get everyone vaccinated in our community. So far, 78,482 Nashvillians have received the vaccine's first dose. That's 7,500 more individuals from last week. And of these, more than 44,000 have received their second dose. And as was noted, last weekend we began phase 1B in our city, in which many teachers and staff from K through 12 preschools and daycares have been vaccinated. And we're continuing to make great progress, and hopefully we'll have a majority of these individuals who want the vaccine vaccinated within the next week or two. We also have been making great progress vaccinating our residents over 70. 50% of Nashvillians over 70 years old have now received the first dose of this vaccine. And we continue to vaccinate these people at the Music City Center 7 days a week. And beginning tomorrow, residents over 65 can make reservations and receive their first dose of the vaccine. Appointments can be made by going to covid19.nashville.gov or calling our hotline at 615-862-7777. Also, I want to remind people that vaccines in Davidson County are also happening at other locations throughout our community. Health systems such as Vanderbilt University Medical Center, or even the VA Medical Center, who under federal jurisdiction is actually vaccinating individuals 55 and older. So if you get your health care from the Veterans Administration, know you can get your vaccine there if you're 55 years or older at this moment. Clinics such as our federally qualified health systems and Siloam Health are providing vaccines, Meharry Medical College, and places including the Walmart Supercenter on Charlotte, who for the next 5 days will be having an event to mass vaccinate as many people as possible. If you want more information on this, go to walmart.com/COVID vaccines. And just so you know, Walmart will follow the same guidelines as our counties. So anyone 65 or older or who qualifies in phase 1A or 1B can be vaccinated through their event. Now, these numbers are heading in the right direction, and we have no metrics in red for the first time since October 10th. Now, let's keep the momentum going. Please get your vaccine when it is your time. But until then, do what you've been doing. Keep wearing your mask. Keep social distancing. If you're concerned about being exposed, get tested. If you test positive, don't forget about monoclonal antibody therapy. I'm very grateful to everything you've done, Nashville, and it's been an amazing 100 press conference. And let's keep it going. And I now would like to turn it over to Dr. Berteau.
Good morning, and thank you, Dr. Jahangir. It's a pleasure and a privilege to be here with you and to be part of this very important public health endeavor. I was reflecting on Mayor Cooper's report about the milestone that Nashville and Davidson County have reached so far. Sadly, I have to remind you of another milestone. This country has lost 500,000 people to this virus. So we owe it to them. We owe it to them. We need to win the fight against coronavirus, period. And we have the tools to win this fight. And the report that Dr. Jahangir and Mayor Cooper have provided are very encouraging. So we are very hopeful because we have at our disposal all the tools to win this fight. We have this mask, we have social distanciation, hygiene, and most importantly, we have 2 authorized vaccines. And I myself had received the vaccine. I had to put my first in line because I lost relatives and friends to this virus. So I know what it is to live with and to die from coronavirus. I understand that we're not there yet. Many people who need the virus cannot get it. So we need to revise our logistics to ensure there is equitable distribution of the virus. At the same time, we understand that people are sometimes hesitant to receive the virus. That's why we are going to organize these town hall meetings so we can meet with people to know where they are, to understand why they are so hesitant to receive the virus. So we can draft better public health policies to refine our approach to distributing these vaccines. And together, we will win. And we have made some progress, but we're not there yet. So once again, we have to deploy all the tools at our disposal: social distancing, masks, hand sanitizing, and the vaccines. And thank you. So I'll be glad to entertain any questions you may have. And so I will wait for you at next week. We'll talk again at the town hall meeting. So now I have the pleasure to introduce Ms. Jackie Schrager from the Health Department.
Good morning. We all know there are many people in our community who have lost jobs or gig work or self-employment, and they're not earning much income now. These people are all eligible for health insurance. It's possible to get it through the healthcare marketplace. A special enrollment period is now open now through May 15th, 2021. But we urge you to get it as quickly as you can. The price of the insurance is on a sliding scale depending on your income and the size of your household. A large portion of people are able to get health insurance for $50 to $75 a month. Healthcare.gov is the site to get enrolled. But many people need assistance to estimate their income, especially since it's so variable and uncertain for the year 2021. You can get help at the Lentz Public Health Center every Monday and Thursday morning. The address is 2500 Charlotte Avenue. To get an appointment, you can also call 615-340-5616, and they will direct you. You will need to bring proof of income and proof of residency and perhaps some other documents. Thank you very much. We look forward to seeing you at Lentz.
Thank you, Jackie. We'll now begin taking questions first from Nikel Smith. Nikel, good morning.
Good morning, and thank you all for taking the time to answer our questions today. I just have two. The first one being, we've seen the situation in Shelby County and the challenges with the vaccination process that's happening there. What are the policies in place here in Metro to help ensure that vaccines are not wasted and that the issues that we've seen in Shelby County don't happen in Davidson County? And then my second question was, are there any indications as to when the supply of vaccine will improve for Davidson County? Thank you.
Thank you. Dr. Jahangir.
Great. Thank you for that question. So our processes here in Nashville are as follows. The state provides vaccine supply to us when those that, for example, the Music City Center or other places that we don't directly. So let me step back. We allocate certain amount of vaccines to certain clinics such as the FQHCs, our health systems, and so forth. We have a very clear inventory of what goes there and keep a regular update of what is being used and not used there. Secondly, those vaccines, a majority of which we use as a public health department at Music City Center, we keep in one building in Lentz Public Health Building. There is a room with several of these large freezers that we need for sub-zero temperatures. That room has access to by several people. Card access and code access. So we know exactly who's going in, who's coming out. It's not just one individual, so there's checks and balances there. We have a very clear inventory of, that we know exactly what's there, what's been used. And we also have a process that, let's say we take 100 vials to Music City Center that are thawed out. And those 100 vials, 70 of them are used. The 30 vials that aren't used, we bring back that evening, place it in another fridge that then makes that the priority for the next day, so that we don't allow the 5 or so days that you have to use a vaccine once it's been thawed to expire. We know what needs to be used first. We use those first, and in situations such as the winter storm, when we had 400, 700 total doses that were about to expire. We also have groups of people. For example, the rescue mission. A month or two ago, we had some vaccines that were about to expire, and there was a group of laboratory workers that fit in Group 1A that we knew we could quickly mobilize, go to that location, and vaccinate them quickly. So there's several checks and balances, inventory control, and having groups that we can get to quickly. Now, the final part of that is when we have 3-4 doses left, we have a very robust standby list that a lot of people apply to and is used daily. And I encourage anyone that wants to get on that standby list to do that. That's another way we also ensure even one drop is not wasted if at all possible. Regarding vaccine supply, next week we're getting just shy of, I think, 12,000 vaccines that state's allocating to us. That continues to go up. Each week it ends up that we usually end up getting a little bit more than what was initially allocated, and I appreciate the state's partnership for doing that. Johnson & Johnson's review is tomorrow, I believe. Dr. Hildreth is on that panel. If they approve that, if that committee approves it, and we get the FDA finally does all the sign-offs, that vaccine will also enter our supply chain very quickly, and that'll be a whole nother amount of doses that'll go up. So I hope it continues to go up as early as the next week or two.
Thank you. Our next question is from Kathleen Seary. Good morning, Kathleen.
Good morning.
morning. Thanks so much for answering our questions this morning. Mine is kind of along the same veins of the stockpiling question of, the violation that is happening in Memphis right now. Could we just talk for a second about why it's bad to stockpile vaccines like that, and just kind of talk about some of the negative consequences of doing that and why it's so important to not be doing that in Davidson County?
Sure. Good morning, Kathleen. It's very easy. Vaccine needs to get in arms as soon as it's available to us. And early on, I remember a conversation Mayor Cooper and I had. We made it a strong commitment that we will never sit on vaccines, period. We have to have faith that the supply will continue to come, and it very much has. And again, the state has been reliable in giving us our vaccines. And part of our commitment to the state to get that vaccine is we follow their guidelines, right? So they're phasing the fact that we won't sit on vaccine. And so when we get 10,000 vaccines, and we're in a phase right now where we're going to start vaccinating 65 and older and teachers and healthcare workers, there's a reason we're in that phase. It's to get our most vulnerable individuals vaccinated quickly. And so to sit on vaccine takes away opportunities to save many lives, and it takes away opportunities to get our residents back to a place where we can do, like we're doing today, rolling back some of our restrictions. I mean, I'm very proud of what Nashville has done to do that, and the vaccination has helped in that process.
Thank you. Our next question is from Vivian Jones. Good morning, Vivian.
Good morning. Thank you for taking our questions. Mayor Cooper, I had a question for you about your proposal that the council is now considering to reimburse Metro Parks employees for hazard pay overpayments. The payments were made by Metro in error when hours were paid for that did not meet criteria for hazard pay, but were paid anyway. You're proposing now for the city to reimburse itself more than $250,000, and that's something that really would never happen in the private sector. I wondered why that proposal is not putting Metro employees ahead of the people that they serve.
Oh, I'm sorry, Vivian, I may not understand all of the question. I believe what happened is that Metro made a mistake in giving an additional bonus to Parks employees that was inconsistent with guidance by the Federal CARES Act. I think it's been the strong feeling by the council that to reverse and actually have a call on relatively underpaid, lower paid employees to bring that money back was unfair. And it's just not fair. And so Metro Council is making a choice affirmatively not to make employees pay money back that they have been paid. And I think the commitment of the council and of our office is to treat with great respect these employees who had a hard year with COVID also. The federal rules about who gets covered, you can argue whether they were completely fair or not, but clearly we made a mistake and we want to correct it and do the right thing.
Thank you. Our next question is from Jonathan Matisse. Jonathan?
Hi. This is probably a question for Mayor Cooper. The state has talked a lot about how they believe they have one of the most equitable vaccine allocations in the country, but we have these issues where folks from Metro Nashville, like teachers and some older folks, are driving out to rural areas, getting appointments out there fairly easily, and getting vaccinated out there while the schedule here has been held up a little bit because we have such a large healthcare worker population. I was curious if you thought, given that there's a lower uptake in a lot of these rural areas of people getting vaccinated, do you have any concern about the distribution of vaccines in the state, or if there should be some opportunity to adjust the allocation and change the plan a little bit from the state's perspective?
Well, thank you, Jonathan, for your question. I think everybody, Dr. Fauci, everybody has always, certainly Dr. Hildreth has pointed out that the vaccination program is probably the most difficult thing ever done in any country in public health. It's just a huge undertaking. And in Davidson County's case, I want to compliment our public health department. They have been amazing. They get every shot in an arm as quickly as possible. And our acceptance rate here in Davidson County has been very good. And the experience that I've been told countless times has been excellent for the population in getting vaccinated. If there is unused supply in other counties, I'm grateful that, of course, we need to get those shots in arms, and I have no problem with people who can get the vaccine in other counties. More for us, frankly. And that the freedom of that system to go do that and to allocate doses to people that want it, it's a little bit of a pain, I know, for our folks to go to other counties, but I'm grateful that it's open to them too. I'm grateful that other counties have not said, oh my gosh, you have to be a resident of this county always to get the vaccine. And so in the end, we're gonna have more shots and more arms in Davidson County than any place else, and I think our progress in the virus numbers reflect that. And then Dr. Jahanger is daily he worries about getting shots in arms and doing it efficiently.
Yeah, and I just want to say one thing. Every week when we get a spreadsheet from the state saying the vaccines distribution that we were receiving and where we'd like to distribute it, there's a column on there that says county distribution by population. So they're very transparent with us. If they're getting so many vaccines for the state, that per our population, this is the number that should come to Davidson County. And then they have a column next to it saying what we are getting. So I commend the state on their transparency of what an equitable distribution is by population. And as the mayor noted, we may have a higher uptick of acceptance of vaccine than somewhere else. And when there's vaccine that may not be used elsewhere, the vaccine is from the federal government for Americans, right? And I think people should be able to use it. But again, I just want to just make sure I actually would maybe push back a little on the premise that the vaccine is not being equitably distributed to us by our population size. I think it is, given the supply that we've received.
Thank you. Our next question comes from Blake Farmer. Good morning, Blake.
Good morning. My question is about vaccination of teachers. I didn't know if those appointment slots were sort of all full and you were, from what I've heard, it's actually pretty easy to get the slots, which makes me think that maybe teachers are not volunteering to get the vaccine maybe as quickly as you all would like. How is uptake among teachers?
Dr. Jahanger.
Blake, I will say the vaccination, so there's two ways, two parts of your question. Uptake amongst teachers appears to be very similar to uptake amongst healthcare workers, first responders, et cetera. There's probably about 20-30% of individuals that are not going to get the vaccine. And that seems to be where we're tracking with teachers at this point. And you're right, there are vaccination spots open, and the reason they're open is because we have some great partners in HCA who, and again, when we laid this plan out, we wanted to make sure everyone had access, right? So VUMC is helping vaccinate our Metro Public School teachers. So they have a process and they've calculated the number of spots needed to make sure we have vaccines, and there's openings there for them to do that. HCA and TriStar have helped with our private parochial independent schools, as well as daycares and so forth. So they made sure they had the same amount of spots needed to do that, and they've had a great process. At the same time, the Music City Center, we left open to make sure our seniors and others get vaccinated. So the reason there are openings, I would say, is because it's just the way we've operationalized it. We've been fortunate that the plan seems to have worked out fairly well so far. But my understanding, and I haven't checked the numbers the past day or two, but the uptake appears to be running very similar to what it's running at health centers and at first responders.
Our last question I'm going to read from a text is from Alexandria Adams at Channel 4. Alexandria wants to know, is there a date as to when teams will be going inside of minority communities to vaccinate?
Well, Alexander, I'm not sure I fully understand the premise of the question. I mean, that we are actively we actively have a plan that is trying to vaccinate people of color, immigrants. That plan involves partnerships with Meharry, our federally qualified health centers. My hope is, as J&J becomes approved and there's more stock, we have mobile teams that do actually go into towers. We went a few weeks ago into a retired teacher's home, which was predominantly people of color, and vaccinated them. I do want to share some statistics with you, again, of people over 70, because again, I want you to remember 1A and 1B are occupation specific. People over 70 is the first time our general population has had an opportunity to be vaccinated. And of individuals who are white, who are over 70, 45% of those individuals have been vaccinated. Individuals who are black, who are over 70 in Davidson County, 32% have been vaccinated. And of people of Hispanic ethnicity in our county who are over 70, 40% have been vaccinated. So while I would love to see those numbers continue to go up, I think we are making reasonable inroads. The partnerships that were discussed earlier and the town hall next week, another important step. But I would say that the efforts are continual, and there's not a set date that we're going to start something that we've been doing for the past many weeks.
Well, those are all the questions we have this morning. I'd like to thank Dr. Berteau, Jackie Schrago for joining us, and we are always grateful to Amy Langkite and our partners at Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing will take place Thursday, March 4th at 9:30 a.m. Thank you for joining us, and that concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.